At the end of this video, I'm pretty sure that you're going to understand diabetes like you know your fingers.
Are you sure?
Diabetes is a chronic condition, meaning it's long-lasting, that involves a problem with how your body handles glucose in the blood. Normally, when you eat your sugar-containing food like carbohydrate and the likes, that food is digested into glucose, and glucose is absorbed into your blood, but that is not exactly where it is needed.
No, they will go keep you.
That glucose is needed by the cells in your body. Glucose is like fuel for these body cells. Body cells need glucose to generate energy to function. So that glucose in your blood has to leave the blood into the different body cells. This is where insulin now comes in.
Yes,
So insulin is that chemical that facilitates the movement of that blood glucose into the body cells. When the glucose level in your blood goes up, it signals to an organ in your body, and that organ is called the pancreas. It tells the pancreas to release insulin. Insulin acts like the key that opens up the door in cells, allowing glucose to move from the blood into the cells. So here's the problem in diabetes. Either the body is not producing insulin as it should, or the body can't use the insulin that it's producing as well as it should. The sugar level gets high when insulin does not perform its function properly. There is a range that blood glucose should be. The pancreas, through the insulin and other chemicals like supporting chemicals that are produced in the body, help to ensure that the blood glucose level is regulated. In other words, they ensure that the glucose level in the blood is kept within a normal range always. This is very important, right? That the glucose level in the blood should be maintained within this normal range. Because the moment the glucose level in the blood exceeds this normal range, and the moment that persists for a while, this begins to affect these same cells and organs in the body and begins to have a deleterious effect on them. This is just like the electricity that we use at home. There's a normal voltage range that this electricity must be. This is the voltage that our electrical appliances, your freezer, your TV and the likes can tolerate. Once the voltage is higher than what is supposed to be the normal range for these appliances to function, that's when you begin to see damages. Gone are the days when NEPA restores power supply and you begin to hear oh, oh, oh all over in the house. Those are your bulbs blowing up. This was because at that moment when power was restored, electricity came in at a current higher than what is normal for those appliances. That's a similar thing to what happens in diabetes. Glucose that is supposed to be a source of energy like a fuel for those body cells and organs can begin to have a damaging effect on these same organs when in excess. So the pancreas functions like the thermostat of an electric iron. When you set the temperature of your electric iron to a certain point, say for instance you want to press cutting materials and you set it to cutting, it doesn't matter how much current is flowing into your electric iron. Once that temperature you set it to is reached, the thermostat breaks circuit so as to ensure that that temperature is not exceeded. And when the temperature is getting cooler than what you have set it, what happens? The electric iron comes on again. This is exactly how the pancreas, through the insulin and the other supporting body chemicals, help regulate the blood glucose level and keep it within the normal range. In my subsequent video, I'm going to be talking about what's supposed to be the normal values for glucose in your blood. So ordinarily, if this regulatory mechanism is functioning properly, the blood glucose level will be kept within that normal range, irrespective of how much sugar or sugar-containing food you take in. But when it's faulty, which is the case in diabetes, the control is lost. The implication is that once you take sugar more than you need in your body, the glucose level in the blood rises higher than the normal range. Because the system that takes care of the excess is already at fault. I mentioned when I started that diabetes is a chronic condition, meaning it's long-lasting, which means once you are diagnosed with diabetes, it doesn't really go.
Don't tell me that kind of thing.
So it's not like some conditions like infections that you say that you use the drug for a while and after you use the drug, the condition has disappeared. The reason I'm placing an emphasis on the fact that diabetes is a chronic condition is because I've seen some patients that once they are started on drugs and they keep using the drugs, a time comes that they begin to check their blood glucose level and realize that it's within the normal range. They then stop the drugs, claiming that their diabetes has been cured. That's an error. Sadly, we have seen patients who stop their medications like that out of ignorance, and the next time we're seeing them in the hospital, they've already developed some complications. Some were even presented in unconscious emergency states, which resulted from a very high blood glucose level. So diabetes is not a condition that we say that we treat in the real sense of that word. Suffice to say that what we do is to manage diabetes. Okay. My aim with this video series is to emphasize the place of prevention, early detection, and tight control of diabetes. Don't keep this to yourself. I am sure there are a lot of people out there who would also benefit from this channel. Kindly like and share this video. Subscribe if you are yet to do so. Till I see you in my next video, always remember that your health comes first.
Okay, let's go.